Hello, my name is Chandra, and I have been suffering with this horrific disease for about 34 years now. I was diagnosed with lupus in 1990 while serving proudly in the United States Army. I was diagnosed with discoid lupus, which transitioned to SLE. Although I have this disease, I try and be the best version of myself. I am a mother to my beloved daughter, Shanjay, who unfortunately suffers from many autoimmune diseases as well. I am a nurse, but most importantly, I am an advocate for the lupus community and their families. Being diagnosed at such a young age was not only hard and difficult to maneuver, but it was also very confusing. You see, back then, there was not much information about lupus, and I was so very young with everything to look forward to. Throughout my lupus journey, I have encountered several situations that have concerned me with my health care, including the doctors that prescribe the medications. You see, I honestly don't think they understand how they contribute to our care and how it affects us, not only physically, but in many ways, with those brief 15 minutes that they see you every 3 months. I know most people still look at us and see warriors managing in society that this disease, but it can have so many attacks on our body, and any part is not left untouched. It makes it even more difficult to live. Currently, I am living with lupus nephritis. Yes, third stage renal failure, and that is very frightening. Not only because of what it brings, but the costs that it brings. There are many assistance programs out there that I have taken advantage of at one time or another. But honestly, I don't think it provided all that I needed, especially being disabled with limited finances. With all the money that we have raised for lupus research throughout the years, by now, not only should there be a cure, but at least more affordable health care for all. I know so many warriors who are trying the new medications that have become available in the past few years, but the cost of them can be unfathomable. My advocacy efforts is not only for us, but for generations to come. So let's stop lining the pockets of big corporations and let's focus on what really matters: people not suffering daily. We don't want to let lupus patients live, but we want to make them thrive without lupus. Managing our illness should not have to be this hard. It should not. Insurance companies are only concerned with the profit, while patients are worried about living their lives. My name is Chandra. Thank you for listening.